Australia today becomes the first country in the world to introduce unbranded packaging for cigarettes. It's an attempt to reduce smoking. Tobacco company logos are being replaced by drab green packaging and graphic photographs of people with smoking-related illnesses. Now, to discuss this, let's talk to Deborah Arnott, the Chief Executive of the public health charity ASH, and Angela Harbutt from the pro-tobacco campaign group Forest. And they both join me from our central London studios. Very good morning to you, ladies.
Good morning.
First of all, Deborah, what is the purpose, do you think, or what will be gained by this sort of packaging?
Well, the primary purpose is to stop the tobacco industry from using the packs to promote and advertise smoking. Children, as we know in particular, are very brand conscious. My children wouldn't wear anything other than Nike trainers. And if you look at cigarette packs, go into any supermarket, any small shop, and you'll see these brightly coloured packs. I mean, the Marlboro pack is iconic. And what it will do is get rid of that. And we know that reducing and getting rid of advertising makes it less likely that children will take up smoking. And just to remind you, smoking kills 100,000 people in the UK each year. That's more people than killed by all the other causes of preventable premature death, including alcoholism, obesity, traffic accidents, illegal drugs put together. And hundreds of thousands of children take up smoking every year.
Angela Harbutt, is that right? Will it put people off? Particularly, let's look at current smokers. Will they care what's on the packaging?
Current smokers want to see their brand name, and they will still be able to see their brand name. We're not stopping them from buying their own brands. But we know from research that's been done, looking at how smokers and non-smokers look at packs using eye tracking technology, that non-smokers and children spend much more time looking at the warnings if you get rid of the other branding elements on the pack, as they've done in Australia. And these aren't plain, these are standardised.
OK. Angela, what do you think of this?
Well, I'm sort of confused, really, as to what really the government is trying to achieve here. We already have a tobacco display ban, which is going to put cigarettes behind shutters in shops. We already know that everybody, man, woman and child, know that smoking is dangerous. And yet they now seem to be thinking that it might be a good idea if we put even larger images, logos and health warnings onto cigarette packets when we know everybody knows that smoking is dangerous and we're hiding them from the public view.
Yes,
I can't see what this is going to help.
Well, what about the point that it might prevent young people from beginning to smoke, because it'll conceal it and these packets will just look so horrible they might be put off?
Well, this is a double-edged sword. We don't know that children are actually going to reject it just because it's got ugly images on. We know what children are like with gross images. And I also think there's a concern here that the more illegal, illicit, dangerous, exciting you make these cigarette packs look, the more likely, the more rebellious children will actually come along and decide they're going to take it up. For example, Class A drugs are illegal. They're not sold in flashy packets, and yet we know that children want to try those too. And I think what we should be looking at, if we really want to stop children taking up smoking, is obviously education and information. But more importantly, how do children get hold of cigarettes, and how do they get hold of these? How they get hold of the cigarettes? And that comes back to basic good, stopping children from being able to purchase them in shops. For example, banning proxy purchases, so adults can't then purchase cigarettes on children's behalf, and making fines much, much larger for those organised criminals who are selling cheap fake cigarettes to youngsters outside school gates. Let's try those activities first before we move to something which is full of unintended consequences and dangers, with no evidence at all, by the way, that this is going to reduce the uptake of smoking at all.
Deborah, is that a fair point?
Well, people like Angela use the same arguments against the larger health warnings, against the graphic warnings, against the ban on advertising. And actually, we've seen smoking rates amongst 11 to 15-year-olds halve in the last decade. They've declined at a faster rate than smoking rates amongst adults. But as I pointed out, that still means hundreds of thousands of children are taking up smoking each year. So this is a proportionate measure, and I'd support Angela in the idea of banning proxy purchasing and making the fines heavier and all of those things. But in terms of proportionality, smoking kills more people than any other preventable premature cause of death. And many people who aren't killed suffer terrible death and diseases from this. I mean, it's a major cause of blindness through macular degeneration. It exacerbates diabetes. If you've got AIDS or HIV, then smoking actually makes it more likely that your disease will progress, your illness will progress faster. So there's all sorts of reasons why we should do this. It's a proportionate measure, and it's a measure that will protect children.
OK, Deborah Arnott and Angela Harbutt, thank you both very much for joining us.